Hey guys, my name is Caden McDonald, and today I'll be talking to you about an article over the effects of low-level laser therapy and eccentric exercises in the treatment of recreational athletes with chronic Achilles tendinopathy. So, just some basic background stuff. Tendinopathy is a common disorder of the musculoskeletal system. Degeneration of the tendon has been found with chronic tendinopathies. Eccentric exercises are the main things to do when doing rehab in order to increase muscle strength and everything. And then low-level laser has a potential to modulate both the inflammatory and the regenerative processes. So the purpose of this study was to see if the addition of the low-level laser will cause a more rapid clinical improvement with pain and recovery. Materials and methods. There was 52 athletes that came in for the chronic Achilles tendinopathy. They were then split into two groups. One had the eccentric exercise plus a low-level laser therapy, and then they had another group that had the eccentric exercise plus a placebo laser treatment. And so the study was conducted over 8 weeks, and 12 treatments were applied to the Achilles tendon with the laser. They would do 6 points between the 2 to 6 centimeters from the insertion on the calcaneus at a density of 60 watts per centimeter squared. For their outcome measures, they used the VAS, or the Visual Analog Scale, and so they gave them a baseline before the study had started. They took another one at 4 weeks, 8 weeks at the end of the study, and then they had them come back at the 12th week and see if their recovery had still been beneficial. So for the results, pain-wise, the laser group was significantly better at all points except the baseline, of course, because none of the treatments had been applied yet. And then the 4-week results of the laser group was equivalent to the 12-week follow-up of the other group, which had the eccentrics plus the placebo. And then there were 4 patients that complained of side effects. This did not come from the laser, it was more from the eccentric exercises, just because that eccentric lengthening of the muscle is what makes us sore. And so they had aching pain in the calf, but they adjusted the exercise in order to help decrease that pain. So for the conclusion, the low-level laser therapy with the parameter used were safe and effective, and then they found that using the power densities below the 100 watts per centimeter square are important to get the good results. For a clinical application, I would use this, like the same treatment parameters, and use eccentric exercises, of course. But for the critiques, I would like more detail on the eccentric exercise program. I think they just gave a couple exercises in the paragraphs, but they didn't have like specific sets, reps, weight, anything like that. They basically gave a description of the exercise itself and how to do it, and then exactly what they adjusted, like the type of exercise, or if they added different ones from the 4 people who complained of the side effects. So for future studies, I would like to see the effects of the low-level laser therapy on other types of tendinopathies, and I listed some examples here. And that is all I have. Thank you.